My name is Micheal Brown. I'm a Kalkadoon Barda-Browner Wanji man. Born in Townsville, live up here in Cairns. Today in Australia, Indigenous people are still twice as high of risk of acquiring HIV than any other demographic. HIV today doesn't have to be a death sentence. The reason why I'm here is to get people to come in and get tested. People need to know that they're at risk. I didn't realise I was at risk. So when I started doing my study in Indigenous primary health care, there was no sexual health studies. I didn't know anything about sexual health before. When I used to get a regular test, it actually came back HIV positive.
When Micheal first came to Wuchopran, he was obviously trying to see who he could trust.
People still have stigma and fear around sexual health. Disclosure isn't easy. I don't want to be judged.
There's a certain fragility in HIV positive patients coming to see you because they're carrying quite a lot with them. It causes quite an impact on their mental health. And so it was very important for me to know who he trusts, who he's around, who in the community have stood out to him, and one of those was the pharmacist.
So Micheal came in one day and interviewed me, basically for the job, to be his pharmacist.
I had a lot of fear around walking into a different pharmacy and telling other people around my status. But when I went in and met Belinda, I gave her my script and I looked for a reaction. And I'm like, is everything okay? And she's like, it's just medication.
Now it's a treatable disease. So that's what I tried to convey to him, that he was safe here, he was respected, anything he told me was confidential, nothing would leave the shop.
No, well, I didn't really know much about my health record in the beginning. I really didn't want to share my information. And legally, a lot of people don't need to know my status.
I can understand why Micheal, an Indigenous man living with HIV, is concerned about his privacy. My health records have a lot of very personalised information on there, and people have this fear. They're concerned about where the information might go and how it could be used.
And in fact, Micheal and I have had a conversation about privacy and digital health. And so what I was saying to Micheal is that he can be in control of his My Health record. He can actually go and have a look himself at what information is shared on his record. And if he felt that there was some information that he didn't want to share, we would be able to censor that. And in fact, every time you upload information to My Health record, you'd be able to then choose which information you're uploading.
My doctor makes sure that I have confidentiality, but also it's nice to have long-term doctors, for that continuation of my care. This way I get a choice of who I share my information with. It'd be great if it was easy and stress-free, with no shame and no stigma. So hopefully My Health record will help the doctors and the experts to further break down stigma and shame for all people accessing their services. That'll encourage people to come in, use the services and keep all their health in check.